presenter will be Dr. Athul. He'll be talking on intraocular diathermy instrument, a challenge overcome in VR surgery.
Good morning, respected judges and dear audience. So let's look at a routine case. Let's look at a routine case of advanced diabetic vitrectomy. So as you see, the membranes are being cut and then the bleed starts happening. So we have to go out, get in a cautery to cauterize the bleeder. And then again, we will take, after cauterizing, we'll take the cautery out. And then we'll continue. But by the time, as you can see, the bleeding has started from somewhere else and the entire field is filled with blood. So this is how the idea began. How could I have prevented this? What could I have done differently? So I would like to present to you intraocular diathermy instrument, a challenge we have overcome in vitreoretinal surgery. So conventional diathermy probe is point shaped, as you saw in the video. The surgeon must push on the blood vessel with the probe to close it and then coagulate it. High energy levels are needed and often it leads to collateral damage. And tip of the diathermy probe, sometimes it can block the surgeon's view from the blood vessel. So you are not seeing actually what you're cauterizing because the tip can block it. And this unavoidable delay when you change the instrument can cause excess bleeding inside the eye. So this is a major deterrent in performing advanced diabetic vitrectomy surgeries. So we thought, how can we combine a membrane peeling forceps with diathermy? Can I give the membrane peeling forceps diathermy ability? So with that point in mind, we wanted to apply mechanical compression from opposite sides, at the same time giving it diathermy function, and it can also be used to peel the membrane. So you hold your membrane, cauterize it, and then peel it immediately. So how can you do it with one instrument when you are doing a 3-port vitrectomy? So we wanted a material that is conductive. It doesn't dissipate heat in the shaft of the instrument, only at the tip, and it should have good temper and hardness, and can be operated with. You can have a separate foot switch for the cautery function, or you can have a button on the handle which can cause the cauterizing ability. So with that, with the assistance of Chennai Surgicals, we have developed the first prototype. As you see here, this is a 20 gauge instrument. This works with a push button system. So the push button system closes the forceps, and there is a foot switch which can be pressed to give the cautery. So only the cautery is delivered only when it's needed. So you hold your thing, and then when it's needed, you deliver the cautery. So as you can see in the cross section here at the circles, so the outer circle and the inner circle are conducting two different poles of the bipolar cautery, and inside the white area that you see is the insulation material. So there is no contact between the outer circular cylinder and the inner circular cylinder, and each cylinder is connected to the one cylinder to one prong and the inner cylinder to the other prong. So when they come in contact with each other, the diathermy happens at the tip of the forceps. So that's the concept, and that we have developed the first prototype. So now we are going on to make 23 and 25 gauge instruments, and we are also trying to give cauterizing ability to other instruments like retinal pick. And also, as you can see in the video here, we are also working on making endolight and endolaser together, so that laser can be delivered with the endolight itself, so that one of your hand is free and you can have something else. Maybe you can indent with one hand and then illuminate and laser at the same time. You don't need an assistant, something like that. So we are working on that as well. Thank you.
Can I comment on this? Well, in 20 gauge era, we used to have the same kind of instrumentation which had a pick, an aspirator, and a light.
Yes.
In all three. So that was the original by Dr. DeJoan and Dr. Steve McQueen. But what I find, your forcep idea is good. Only thing I feel it lacks the tactile sensation and ergonomics. Because when you are peeling a membrane, you like to squeeze, have the membrane and then peel it. This is too much of a, I think that tactile sensation is rather important while peeling. Thank
Okay,
you.
sir. Thank you, sir.
Dr. Gopal S. Pillai, can you ask him questions?
Excellent innovation.
Thank you, sir.
So, have you done some surgeries with it? What are the challenges that you faced while you were doing surgeries with it? Have you
So
done some?
we have not moved into the
Okay.
human trials is way down the line.
All right.
Even animal trials, we are it's pending. We are trying to make a pig eye setup in which our team from Netherlands had did the same thing by cauterizing vessels of a cadaveric pig eye. So we are working on the porcine eye. The study is going on. But human trials are way down the line. But before that, we want to make it into 23 and 25 and then try it, because there's no point in experimenting with 20 gauge right now, because that era has passed by. So, but we are making good headway, and a lot of progress has been made.
What are the challenges that you feel?
So the main challenge right now is coming onto a definite insulation material. Like I said, we have two cylinders. So the white area that you saw was an insulating material between the two cylinders. So the exact material that can insulate both these things, we are trial and error we are doing. Some material are stable, but after about 50 autoclaves, they are disintegrating. So we want an instrument that can be autoclaved multiple times and reused. So we are working on the materials and hardness. We have almost achieved the good hardness, but this insulating material is one of the challenge we are facing right now. But we are making good progress.
Okay. Thank you.
Weight of the instrument will also have some weight. How much weight that?
Yes, sir. We are trying to make it a very thin, just similar to the membrane peeling forceps we use, but definitely weight is something we should take into account.
I suggest you connect with the metallurgy department of Indian Institute of Science.
Yes.
If you spend a week there, I think they will crack the thing.
Yes, so actually there is a metallurgical department working with the instruments team. So they are working in tandem. It's just that the metallurgical people are a bit slow in their, like, they take their time.
At IAAC, Indian Institute of
IISc.
Science.
Okay,
Indian
sir.
Institute of Science.
Sure, sir.
The best in the world, they are there.
I'll do
And they
that,
are very cooperative.
Okay, sir. Thank you, sir.